Morning, guys. Right, I am outside rising because it's World Mental Health Day, and I was asked to get up and rise for mental health awareness with the sunrise at 7 o'clock this morning, just to raise the awareness of mental health. And mental health is massively close to my heart. I'm, as an occupational therapist, I chose my career down the learning disability mental health route. I have worked for years with children and adolescents with mental health and learning difficulties, and now I work with adults who learn with mental health. And you know, it's a big passion of mine that I've seen over the years. I've seen children develop mental health difficulties. I've seen adults who don't understand what's going on with their body and find it difficult to accept they've got mental health. And it's about raising the awareness. You know, they say that nowadays the research suggests that mental health happens at around the age of 14, and that's because of the changing world of today. And you know, we've got to do something to improve the awareness and improve people's knowledge about recognizing the symptoms of mental health, because it happens in so many different ways, and like everybody I meet says that mental health impacts them so differently. And it's about, I spend my day-to-day life educating people on understanding their body, understanding their behaviours, why they are doing what they are doing, and helping them develop strategies so that they're able to go out in the world and live a fulfilling life that they want to live. And it really is close to my heart, the fact that like nowadays they say that 14-year-old people are getting diagnosed with mental health difficulties. And you know, it also says between 10 and 20% of between 15 to 29-year-olds, or suicide is the second leading cause of death between 15 to 29-year-olds. Like, how scary is that? You know, and it's about everybody around the world coming together and raising the awareness. Like, I've done work in Tanzania where people would come over and they'd have mental health difficulties, but other people would say to me, oh, they're just crazy, ignore them. You know, that awareness is not there, and we really need to look at improving symptoms, improving our lifestyles, being role models to people around us, to be able to manage mental health. Like, I've had mental health and anxiety, and yeah, with my food it got quite serious, but you know, I would say until this year I never really had a life without anxiety. I was always a worrier, and I always struggled to manage it. And I used to think that because I was a mental health professional and because I understood all the knowledge, and I understood the evidence base behind it all, I was like, no, I'm fine. I was in denial. And you know, and nowadays I meet so many people on a day-to-day basis who are also in denial, but they don't know how to manage their bodies. They don't know what to do to be able to manage the stress that they're experiencing or the mental health symptoms they're experiencing. So it's about sharing your knowledge and sharing your journey and sharing how you transform your stress or whatever it is that you're experiencing and live a happy, fulfilling life. But we've got to do it for our children. We've got to teach them how to fuel our body right, because food and mood have such a close correlation that we've got to teach them how to fuel their body right, so they grow up having a healthy, nutritious diet, so that it manages them. We've got to teach them how to live a healthy, fulfilling life and be active. So it's about being a good role model. It's about going out there and, you know, and doing walking if you love walking, exercising and lifting weights if that's what you love, going and playing football and taking the kids to play football, whatever it is. It's about getting them active, particularly nowadays when kids are sitting around on computers a lot. You know, it's getting them up, getting them out, getting them being sociable. You know, social media is amazing, but nothing beats actually that face-to-face contact and being sociable with sociable people and teaching them the social skills. Because even now I work with adults who say, you know, I had a difficult time in school, it was really hard for us, I didn't really make friends, and now they're really isolated adult with mental health difficulties because they haven't had that support network around them. They haven't learned how to maintain and sustain relationships and friendships, and they find it really hard. But the younger we get in and the younger we support these people, then the more fulfilling and happy lives that they're going to get when they get older. And you know, I am so passionate about it, that like, it's anything like get them introduce them to mindfulness. And mindfulness mindfulness is amazing. You know, and I always describe it as, imagine your brain is just a big pile of paper on the floor and it's just a mess, and that is kind of your anxiety and your mood, because you're overthinking, you don't know where anything is, you get confused. And then what mindfulness does is it kind of puts it into a filing cabinet, and it organizes your thoughts, and you look back and you think about the situation that you're anxious about, or you know, whatever you're stressing about, slightly differently, because you've had that time to kind of escape from your mind and escape from the situation. So mindfulness, good nutrition, teaching your kids about how to cook good meals, being active, taking your kids out and about, but teaching them strategies that they love to be able to manage their mental health. What works for me and what works for you might be totally different than what works for your child. And you know, you've got to look at being able to help your child find an activity or something that they love that totally helps their health and helps their mental health and switches them off from the world, because we all need it. And particularly nowadays, you know, if people are getting diagnosed at the age of 14 more often than not, we've got to get in there early and get those children and adolescents learning something that they love, that's able to help them manage their mental health, because it's just so important. And it's so important just to listen to them. You know, I think sometimes children think, oh, they're not going to bother, they're not going to listen. And you know, it's about listening to them, being open to them and understanding, and trying to understand their situation from a 14-year-old's perspective, you know, or however old they are. Because as an adult, we can be a little bit dismissive sometimes, but it's about totally thinking, well, it's a different world to when I was a 14-year-old, never mind older generations. And I find now, even particularly older generations now, particularly older males, I talk a lot about accepting that they have got some anxiety difficulties, because they see it as a weakness, they see it as a vulnerability, and they don't want to accept it, that they've got some mental health difficulties. And I spend my day-to-day life kind of educating them around it, doing psychosocial interventions, helping them and supporting them to be able to manage their mental health, so that they can get up and get out and live a fulfilling life that they want to live. And you know, everybody deserves it, and we all deserve it, but we've all got to share our knowledge, we've all got to share our experiences, and we've all got to share our stories, so that the awareness is raised and people can share and learn and do different things. Like that's why I love the coaching and I love my job, but it's because it's all about supporting people manage their mental health. Like this year, the change of lifestyle, the change of diet, the change of exercise for me has transformed my life. I now would say that I totally have control of my anxiety. It still goes up and down, but I don't have a constant level of anxiety that I used to have, and that's because of my lifestyle changes. And that's why I changed my daily career from working with children with autism to supporting people to change in their lifestyles, because I'm so passionate about how a lifestyle can massively impact on your physical and your mental health, and you've just got to take action and do something about it, and you can change your life around. So I just wanted to kind of pop on with the sunrise for World Mental Health Day. So I hope this has been useful. If anyone wants to chat to me about anything I've talked about, or ask me any questions about mental health, about anything, then please just get in touch, because it really is a passion of mine, and I want to help all the generations that I work with, that I come across, that you know, we've got to be good role models for everybody around us. Whoever we connect with, we've got to try and be good role models. Anyway, I've got to go to work now and be a good role model. Right, see you later.